Oh,
Do that. Perfect. Good morning. Welcome to another Promises Behavioral Health University webinar. My name is Callie. This morning, we're going to be talking about holistic trauma treatment with Lauren Bentley. Lauren, you can go ahead and skip to the next slide. Perfect. So as you all know that have been here before, we work with Promises Behavioral Health. We have both inpatient, outpatient, PHP, mental health, addiction facilities across the country. Like kind of what we're talking about today, all of this is encompassed by informed trauma care. We have very intentional trauma experts that work at all of our facilities, and we're really excited to speak with Lauren today. If you have any questions or want to learn more about some of our facilities, you can go to promises.com, or if you have any specific questions, you can put them in the chat to me, and I will help you find the right answers. To speak a little bit more about Lauren, let's see. So Lauren is our Director of Clinical Operations at the Ranch, Tennessee. So Lauren has been, she's a licensed clinical social worker and got her master's from the University of Tennessee College of Social Work. And what I really find particularly amazing about Lauren is that she's been with the ranch for a long time, and I've really watched her shape our clinical program there. So everything that she does is very intentional, from the way that the ranch is growing physically to also how it's growing in its clinical programming. As we all know, it's not just about the addiction or about the mental health, the disease that's actually involved. She understands, and her philosophy is really about treating the person as a whole. That includes their body, mind, and spirit. So I'm really excited for this webinar today. Lauren is doing such great things, and I think you all are going to learn a lot from her. So Lauren, I'll pass this over to you if you want to talk a bit more about the ranch.
yeah, absolutely. So I'm Lauren Bentley. Thank you, Callie. So just a little bit more background about me, and we'll do some housekeeping stuff about the CEUs that I know everybody wants later too. But just a little bit more about me. So I have been in the field for a little over 10 years now. I actually started working with kids and working in crisis, and working with individuals with disabilities. When I moved into the residential world, I started in 2017 at the ranch. And I identified as a baby therapist, is what I used to call myself. And when I started, that's actually where I was able to get all my hours for my clinical licensure, and where I really developed a passion for working with individuals who have suffered from trauma. I started out working in the eating disorder program, and really developed a lot of my clinical skills. And I feel like I am the clinician I am today because of my work that I've done at the ranch. So we are a 128 bed facility. We do treat mental health, substance use, and then also sex addiction for our men. And so we are gender separate, and then we are diagnosis specific. So we have separate housing. So one of the things that makes the ranch, in my opinion, really unique is that we do offer that separate housing, and we are more of a community-based treatment. And so part of the important thing about being in treatment in general is just the community aspect, and people being able to learn from each other and grow and kind of develop some of those social skills that we really need in order to be successful outside of treatment. So throughout the training today, I'm going to talk a little bit more about, just from my experience, and I think a lot of what you'll hear throughout is the holistic approach that we have at the ranch, and then being able to talk and expand a little bit more on how we can use that in all different types of practices. And so I'll refer back to some of my time in private practice as well.
Okay, just a few housekeeping things. Same as always, the chat box is for me. So if you have any questions about CEs, your technology, your computers, webinar functions overall, put those in the chat, and then please reserve the questions that you have for Lauren for the Q&A. So try not to use the Q&A for your technical issues or your CE questions. We just want to keep those for Lauren because I'll be sending Lauren those questions, and we want to make sure I don't miss anything. You can skip over to the next one, Lauren. For the CEs, I think I know a lot of you are here for the CEs today. So just know that a lot of you that are here now, you're doing a great job already, because you can't miss more than about 5 minutes of this training to receive your CEs. So if you registered through Zoom prior to being here today, your email is collected, you've shown up today. Please don't ask me to verify or if you're here, because I really can't check anything while we're in the Zoom. So after the training, I'll download the list. It's kind of like the sign-in sheet if you're here today. And then you'll receive an email from JotForm and PBHU that will say, here is your evaluation for the CE today. You'll send that back in. And then as soon as you send that back in, it sends you your certificate like right away. So there's not like a multi-step process like we may have had in the past. And just a reminder, you'll get 2 CE credit hours for today. And then any other slides and resources that you may want, we'll be sending out in a separate email next week. Also, if you maybe have been here, but you miss too much time or you don't get the credits, you will get an email later today that says like you did not receive credit for the webinar. So either way, you'll be hearing from me on if you have like received the credit or not. So, and give me until next week to make sure I get back to you with your questions. And then also, as always, I will close the evaluation next Friday. You have a week to complete the evaluation. So just make sure that you get that done in time. Okay, I think that's everything. Oh, right, of course, we have more. So July's webinar will be with Jimmy Gassaway. And she works for our corporate office for promises. And so she's over the entire clinical quality that we cover. So she works very closely with Trish. And so she'll be talking to treatment planning to enhance clinical and operational excellence. I think that'll be a really great webinar. And then our August webinar, that one is going to be changing a little bit. The topic will remain the same, but I think we might be pushing that to a different Friday. I'll be sending out the clarity on the August webinar in our recap email next week. So if you're going to sign up for July, I'll send that registration out in a minute in the chat. Feel free to sign up for that today. So we'll continue to have these trainings through the end of the year, last Friday of every month, pretty much. So good to go. Take it away, Lauren.
Thank you. Thank you. Okay, so just a little introduction to what we're going to be talking about today so that you know what to expect and what's to come. I know I hate attending things like this and not having any idea what's to come next. So over the next hour and a half, hour and 45 minutes, we're going to be talking about and defining trauma. So we're going to kind of do a deeper dive into what is trauma in general. Throughout the webinar, I will have some polls. So you will notice that I will ask some questions throughout just so we can get as interactive as possible. I really like to do really interactive trainings. When I've done this training before, it's been in person and interactive. So I wanted to try to bring that here as much as possible. So we will kind of be able to do that a little bit throughout. So we will define trauma. We're also going to talk about what the holistic approach really is, and define that specifically for the purposes of what we're talking about today. I think there's a lot of different definitions for holistic. So we'll talk about that a little bit more. And then we're also going to explore a lot of different modalities in order to treat trauma. My goal today is really that you can walk away, have some tangible things that you can carry into whatever space that you work in with clients or for yourself, have a deeper understanding of trauma, and then maybe have a new interest in a different modality and potentially end up wanting to pursue training in something else. I know for me, whenever I get trained in something, I feel really invigorated and it's really exciting. And so I'm hoping today that we can kind of get a wide brushstroke of what are the different types of trauma treatment. How do we do that from a team approach too? So another theme that you'll notice throughout the next couple of hours is that I like to talk a lot about how we do this as a team and we don't have to do this alone whenever we're treating trauma with our clients. And then just like I said before, so I've been in the field for a little over 10 years now. I am trained in EMDR. So if you notice me lean into that a little bit, no offense to any other modalities, it is just what I know and what I practice with clients. But I do have a passion for working with individuals with trauma. I really find myself wanting to treat the whole human and wanting to help somebody really figure out how do they find wellness and not just recovery from whatever presenting problem that might be, and being able to help people really get to the root of that and live a life that feels meaningful and fulfilling to them. So starting out, just wanted to give a brief history of trauma, how it's been defined in the past, and kind of talk about the evolution of that. If you joined us last time for Sarah's presentation where she talked about the evolution of therapy in general, I thought that was really interesting, and just being able to bring in pieces of that specifically around trauma treatment. So the earliest accounts described the effect of battle conditions on soldiers. And so the earliest definition or snapshot was calling it soldier's heart and nostalgia. These were terms that were coined in the American Civil War, specifically around how they were identifying trauma. This then in World War I, after heavy explosions, they coined this as shell shock. So kind of going from more of we're having a physical response to then having a psychological response. So kind of inching towards probably more of what we think about trauma impact today. During the Korean and Vietnam War, talk therapy started being introduced. So the earliest interventions for trauma for veterans was time off. And so they would give soldiers leave. And then that slowly turned into talk therapy. And then actually post-Vietnam War, the VA introduced group therapy modalities, specifically for treatment of PTSD. And I think one of the common threads that I found when researching and looking into a lot of different modalities is that a lot of them were developed initially for treating veterans. And of course, we all know now that trauma can look and come in many different shapes and sizes, and that impacts people of all different walks of life. But initially, a lot of what was developed was around veterans. And then the DSM-3 in 1980 marked and introduced the definition of PTSD as a diagnosis, and really started working into that space and growing that definition. And just to kind of go back to the initial treatment being giving soldiers time off, I think that that's really impactful to look at, because I think even today, that's how our initial reaction in telling somebody, this is how you can really start to find healing, is to take space for yourself, whatever that might look like. So of course, I really believe in the treatment modality, and I really believe in being able to, find space for yourself by going to some kind of residential treatment if you have access to that. And I think at the core, what treatment does is give people space, and it really creates that for them. When some people can't do that on their own, they can't do that in their day-to-day life. And I think that's why a lot of our clients can stay stuck in private practice. So just thought it was really interesting that it's been around for a really long time to encourage people that are struggling with trauma to take time off, whatever that might look like to them. And then slowly we've moved into more of a trauma-informed care lens. And that's, I think, what a lot of us know today is trauma-informed care. And so slowly we moved from the question being what's wrong with you to what's happened to you. And so moving away from that, I think what I identify as more of a shame-based approach, where we're telling somebody that something's going wrong with them, and instead saying, well, what's happened to you? Like, what is leading to this? And I think it's important to note kind of the shift into more of that survivor mentality. And so trauma-informed care initiated kind of that, helping people seek treatment and seek recovery. And it's designed to help people find their own path to healing, and knowing that that has to be facilitated not only by that individual, but by a support team. And we all define trauma in different ways. And I think a lot of our clients define trauma in different ways. And so being able to talk about what that looks like for our clients, and then what that looks like for us, and being able to appropriately define that when we're working with our clients. So then when we start to get into defining trauma, so SAMHSA defines individual trauma as an event or circumstance resulting in physical, emotional, and or life-threatening harm. So it doesn't have to be all of those things. It could be one, it could be all. And then the event or circumstance has lasting adverse effects on the individual. So that can impact them mentally, physically, emotionally, socially, spiritually. And so being able to talk with our clients about there are different ways that trauma impacts us. It could be all, it could be one, it could be a small portion of one. And this is when I usually ask people how you define trauma with your clients, how you define trauma for yourself. Trauma is an emotional response to a terrible event. And I think a lot of the times our clients can have a hard time understanding that what they're feeling is a direct response to their trauma. When we are the provider, the clinician, we see that so clearly, but I think sometimes being able to take a step out of that and realizing and remembering that clients don't know, these individuals are not aware of what's happening and what could be impacting them, and that the reason that they're reacting the way that they are is because an event or circumstance has resulted in that physical, emotional, or life-threatening harm, and those impacts are, happening on their mental well-being or their physical or emotional or social. And so being able to really talk to our clients about all the different ways that we can be harmed, and that is trauma, and being able to define that for our clients. So I did want to take a little bit of space now to do a poll and ask you, how do you define trauma? And then if you have any examples of ways that you talk to your clients about trauma. So I'm going to start this poll and just invite you to be able to answer this question. So you should be prompted to go ahead and answer that question if you'd like to. Just take a couple minutes. Yep, I see some answers coming through. Look, I love to see so many people answering this. Let's give it another minute or so. Okay. Okay, so we'll go ahead and end the poll. Okay, so let's see what some of your answers were. So it looks like somebody said, let's see. Hold on just a second while I open this up. So it won't let me see too many of these. Let's see here. Okay, so I'm just going to share a couple of these results. So some of you said dysregulation of nervous system, which I think is really a really condensed way to share about trauma. I think with just to say too, with our clients, I think it's really helpful to keep things as short and sweet as possible. Of course, we have some clients that really, and we'll talk about this a little bit more, that really lean into um, how the brain works, and like really wanting to understand it in a really like heady way is how I talk to clients about that. But I think a lot of the times our clients really crave something that's short and sweet and simple so that it's more absorbable. Somebody else said a life experience that changes your life experience, which I like how somebody put that, because I think it does help help a client understand that it's something that's impacting you long term. And so being able to say, okay, so this is a trauma because look how it's impacting my life in general. Then somebody else said teaching about inner child and parenting that wounded, hurt inner child, which I also love, because I think when we talk about going back to a more holistic approach too, and looking at somebody as a whole person, a lot of that can look like inner child work, which I don't talk about today very much, but it is something that I also believe can be really, really impactful. You could probably do a whole extra 2-hour webinar on inner child work, if not more, because I think that that can be extremely impactful too. So yeah, so thank you for participating. I encourage everybody to always be able to kind of have in their back pocket how they define trauma. Yeah, for me, I talk to clients and say, the definition of trauma is something that has a lasting impact on you. So really similar to what somebody had shared in the chat. And being able to, help them identify what that might mean for them. And trauma comes in all different shapes and sizes. And so one of the things that I like to be able to discuss is the difference between big T and little t traumas. We're not saying that one is worse or one is better, or one is going to impact you more. And we're not necessarily, labeling them as big T or little t. I just think that it can help clients be able to compartmentalize and say, okay, well, even though, I'm comparing it to what I know Susie experienced, this still matters, and this is still identified as a trauma, and we can still treat it in that way. And this is usually when I'd ask anybody if they've had a client say like, oh, I don't have trauma, and nothing bad has ever happened to me. And then we as the clinician will know, okay, so yes, there's trauma there. And also I think that there can be almost a stigmatized definition of that, where it has to be somebody that's been to war, or somebody that's, experienced sexual abuse, or somebody that has been in a really bad car accident, somebody that's lost their home, something like that. And so those would be maybe more big T traumas. And so big T trauma is generally related to a life-threatening event or situation. So could be a natural disaster, violent crime, school shooting, serious car accident. I'm sure you guys have other examples of that as well. And then little T trauma refers to events that typically don't involve violence, but do create significant distress. So for some of our young adults and other adults, but I think I see this a lot when I've worked with teenagers in private practice. A breakup can be a little T trauma, losing a job, feeling unloved as a child, ongoing environmental stressors. So being able to help individuals see that even though this isn't what maybe they thought was the definition of trauma, these little T traumas are still things that we can address with these different modalities, and being able to normalize that for a client. I also like to give a little PSA about how I recognize that I think trauma, my opinion, is that trauma can also be overused. That word can be. And so I'm not encouraging us to do that, but I do think we have individuals that minimize what they've experienced, because in their mind, a trauma has to be a big T. It has to be this huge life-threatening event or situation. But then being able to explain to people, no, it doesn't. And that's why we can use these different types of treatments. And I think being able to help clients have that experience, because I hear a lot of clients say, well, I don't want to do EMDR. Like, I don't, it comes down to, I don't deserve to have that kind of treatment because that thing that happened to me wasn't that bad. Which of course there's a lot we can unpack there with our clients. But being able to have that conversation, I think, can be so impactful, and being able to tell them, like, yes, of course you can. But I know we've all had that experience where a client's been like, it's not so bad. And I know that Susie down the street experienced X, Y, and Z. So I like being able to talk about little T trauma specifically with clients like that as well. And then, had to throw in some stats on a Friday morning. Why not? Everybody loves statistics, right? So wanted to kind of talk about co-occurring and how that can, it's something that we have a lot with our clients, where they come into our office and they might say, okay, well, I want to stop drinking, or I have an eating disorder, or I have a sex addiction, or, I'm just really anxious, or I don't know why, but I can't get out of bed in the morning. So being able to hear that and see that, and then as clinicians be able to say, like, okay, so there might be something else going on. So I wanted to kind of put some numbers to that. I will say I love statistics. I don't like gathering data to have statistics. So I really appreciate people that are able to do studies like this and bring this to us, because I think it could be really helpful. So early traumatic experiences may increase risk of substance use disorder because of attempts to self-medicate or dampen mood symptoms associated with dysregulated biological stress response. So up to 59% of young people with PTSD subsequently develop substance use problems. So it's over half. That's a lot. One study found that nearly 49.3%, almost half, of eating disorder patients admitted to a residential facility in the US had symptoms compatible with a PTSD diagnosis. So maybe not necessarily diagnosed yet, but did have those symptoms that could lead to a diagnosis. Another study around eating disorders, so 43.8% of individuals diagnosed with an eating disorder reported experiencing more than one traumatic event in their lives. And then according to a study conducted by Patrick Carnes, who some of you might be familiar with, a significant amount of people with sex addiction experienced emotional abuse, 97%, sexual abuse, 81%, and physical abuse, 72%. And of course, at the ranch, we do have that sex addiction program I was saying about for men. And I think a lot of the stigma around sex addiction is that it is somebody that is having a lot of affairs only, or it is somebody that is watching a lot of porn, which those could be behaviors, and that might be true. But any of us that work with individuals with sex addictions know that a lot of that is trauma based. And I think a lot of our different disorders are trauma based. Of course, that's, my opinion is that, and that's why I'm here talking about this, because I feel really passionately about addressing the underlying trauma and doing that in a holistic way in order for people to find wellness and be able to recover and feel better. And it's really hard to not address the presenting problem that comes into our office. And I know we've all experienced that. Somebody's like, no, I don't want to look at that stuff. Like, no, thank you. I don't want to talk about my childhood. I want to talk about the fact that I'm drinking every day, and being able to do both and talk to clients about that. But I did want to highlight the co-occurring statistics, because I do think it's pretty eye-opening. Most of us recognize this too. But being able to talk about it a little bit more. And then sometimes I think it's helpful to share this kind of thing with some of our clients, depending on the client. And then next, we're going to talk about trauma in the brain. So I do have a super short video to show you that just helps us understand trauma in the brain and kind of can give us a framework. I think this is also a good video that could be shared with clients. So we're going to watch that real quick. You might have to turn your volume up so that you can hear it on your end too a little bit better.
The brain develops from the bottom up. The first thing to develop is the brainstem, or the reptilian brain, as some people might call it. This area is responsible for our bodily functions. It tells us when to regulate our temperature, when to sleep, and when to eat. The next important part of our brains to develop is the limbic system, or what some people might call the mammalian part of the brain. The limbic system supports a variety of functions, including emotion, behavior, motivation, and long-term memory. The next part of the brain to develop is the cortex, which is the outer layer of the brain. This is sometimes considered the human part because humans are one of the only mammals that develop this part of the brain. This part of the brain is responsible for how we as humans were able to develop language, have thoughts, self-awareness, perception, and consciousness. Also, the cortex plays a key role in integrating the central nervous system and functions of memory. The last and most advanced part of the brain to develop is the prefrontal cortex, which is considered the executive functioning part of the brain. For some people, this part doesn't fully develop until they're in their mid to late 20s. The prefrontal cortex helps us to think through cause and effect, the ability to plan for the future, set goals, and understand the consequences of our actions. It's also responsible for the ability to moderate social behavior. When we're in a stressful situation, part of our limbic system, called the amygdala, sets off an alarm bell response to let us know we're in danger and we need to do something about it. When this happens, the brain floods with a hormone called cortisol, so the body knows that something needs to be done. The most common responses to a stressful or dangerous situation are some you might be familiar with: fight, flight, freeze, or submit. This is an inbuilt system of survival to keep us safe when we're in danger. Like when our ancestors might have had to decide whether to stand their ground and fight against a large predator or run away. A stress response is a healthy, normal part of being a human. It lets us know that our bodies are working and keeping us safe. If a person is exposed to a highly stressful or traumatic event, or they have continual exposure to stressful events like abuse or neglect, their alarm system might become overactive. It might be always switched on, as if there was a risk of danger or threat at all times. For a child, this might affect how their brain develops. This is especially the case if it's in the context of stress or trauma events by a primary caregiver. In these cases, the child might develop an understanding of the world as an unsafe and dangerous place, even when they are in a safe situation. Sometimes this is called hypervigilance. It means being on edge or aware of danger at all times. Being exposed to stressful and traumatic events on a regular basis can also have a significant impact on neural connections in the memory center. It can even change the way we remember actual events. People use alcohol and other drugs for a variety of reasons. When someone's experienced trauma, they might be in a constant state of fight or flight, and so might use substances to help move them out of their stress response state. We also know that substance use can affect the way that our brain functions. Chemicals from substances cross the blood-brain barrier and can either stimulate or depress different parts of the central nervous system, affecting how the person feels, thinks, and acts. Similar to cortisol flooding the brain in the stress response, chemicals from alcohol and other drugs can also affect neural pathways and the way the person might make decisions or remember events. Luckily, neural pathways have the lifelong ability to form and change. You might have heard this referred to as neural plasticity. Through developing a better understanding of the brain and the way trauma and alcohol and other drugs affect neural pathways, clients can be better informed and empowered. This is an intervention itself called psychoeducation.
Okay. So I like to be able to use things like that because once again, I'm the first to admit that talking about the brain is not my strong suit. Some people do and they love it. And I also have some clients that really love to learn and hear about it. I think that knowledge is power. And I really do believe that clients are able to gain a deeper understanding if they recognize that something's actually happening for me, something's actually going on in my brain, rather than I think a lot of that shame response, which is, well, I just can't get my act together and I don't know why this is happening to me. And, if I could just be stronger, which I'm sure a lot of us have heard, if I could just be stronger, be better, when really we can say, no, like something is literally going on in your brain that is impacting this. I also use this with clients that are experiencing substance use, like the video is saying, and somebody that's in their active eating disorder, somebody that is acting out in their sex addiction, talking about that there are things that are happening in our brain that we aren't aware of, and we don't have, quote unquote, control over that. Which for some clients is going to really, freak them out. They want to have control, maybe, if that's, what comes up for them. But being able to tell them, like, there's things that are really going on scientifically. And, hope is not lost because that's why we're doing treatment. So I think, also some clients will say, well, okay, well, if that's the case, if that's what's happening in my brain, like, what's the point? Well, through different treatment, through different modalities, by finding recovery, by healing, we're actually healing our brain. And so, like the video was talking about, being able to actually change our brain when it's been impacted in this way that was so out of our control. And so being able to flip it from, well, you have no control because this thing is happening to you physically, to like, we're actually able to do something about it. So some of our doer clients or our clients that really want to take back that control, being able to look at treatment in that regard. And I think a lot of times our clients aren't able to really see those changes really quickly. And I think a lot of, especially in today's society, we want to see our recovery fast, and it just can't be fast. So being able to talk about what might be going on a smaller scale that we're not aware of, just being able to give clients some of that encouragement. So for the clients that it's the good fit for, I like to share about the brain. Once again, I'm very mindful about how I do that. I have a lot of respect for people that can memorize and know all the ins and outs and can talk about the nervous system and the vagal and all the things. I, am humble enough to recognize that is not my area of expertise. I, once again, appreciate it a lot, and I think it can be extremely powerful. So being able to use little clips like that can be really helpful. And then then being able to then translate that into now talking about this next slide, which is the window of tolerance, and being able to put that then once again in terms that maybe feel good for a client can understand. And so when I talk to clients that are really having a hard time regulating, and maybe that's because something, there's been big life circumstance, or there's been multiple, and that window has just gotten smaller and smaller. So once again, I like to use visuals with clients. Somebody recently was telling me that, only a small percentage of us can learn and absorb things when we see them for the first time or hear about them for the first time. But being able to have something tangible and learn it, and being able to lean into it in a different way that feels more tactile, can be really helpful. So kind of little things like this can go a long way with our clients, giving them something that feels like a thing. And so some of our clients love handouts. They love being able to walk away from session with something. I think we talk a lot about like tools in our toolbox. So being able to do something like this and give them something like a visual like this can go a long way. So when I talk to clients about their window of tolerance, I like to use this visual. And then also sometimes, like if you have a whiteboard in your office, I will draw it as this expanding window that gets smaller and smaller and smaller. And then when we're in treatment, it gets larger and larger and larger. And so being able to give clients different visualizations to be able to recognize that. And so when our window of tolerance gets really itty bitty tiny, that's going to push us into dysregulation really fast. And so that's going to either look like hyperarousal or hypoarousal. And so, telling clients and talking about this of like either you're going to explode, that fight or flight's coming in, or maybe you're going to freeze. So it could be one or the other, it could be multiple, it can depend on who you are, what you're experiencing. But really being able to normalize for clients that when that window shrinks, there's only so much you can do. And then talking about what does treatment look like when your window is really tiny, and telling clients it's not because we only want to stay in the most comfortable space, but as we're doing treatment and we're doing treatment that's appropriate, is we're expanding and we're slowly widening that window. And so clients, I have some clients that are like, is my window ever going to get bigger? Yes, of course it is. And that's why we do a lot of this treatment. And so for some of those clients, being able to say, we're sitting on a lot of this really uncomfortable stuff because we're expanding our window. Trauma therapy, recovering, going to therapy in general isn't really fun. I tell clients that all the time, like, this isn't supposed to be a good time. This is really hard stuff. Recovering from trauma is really, really difficult. It can be so powerful and there's so much good that can come from it. But as we're expanding that window, it can be really hard. And so being able to normalize for people, you probably aren't going to want to sit in this. And that's why we're doing this together. And that's why, going back to the holistic approach, there's so many different things we can do to try to help navigate how difficult this is, and being able to say, well, we can do this really hard modality, and then there's also other things that we can heal that maybe feel a little bit more comforting. So being able to normalize how hard therapy is too. I always like to tell people that I had this experience with a client where I was starting the reprocessing phase of EMDR with him. And those that are familiar with EMDR, he had the paddles, and we were using the paddles, and he actually like threw the paddles and like stood up and was like, no. And so for him, he was like, he didn't understand what had happened. And I'm like, well, this is like very, very uncomfortable. And so being able to normalize that with our clients too, and say like, it's okay. You don't have to want this in that way. Like, this is going to be really difficult. But talking about the window of tolerance and how we need to stay safe. And so we're trying to expand that window, but we're not pushing ourselves out of it. And we're not doing that too fast either. Because recovering from trauma can take a lot of time. But being able to normalize for clients that this is really what we're doing. Like, if we need a visual of why are we in treatment, what are we trying to do here, really expanding that window of tolerance. So now I have another short video. So this is the hand model. So another kind of interesting way to be able to talk about the brain with our clients and be able to actually kind of show what it's like whenever we're becoming dysregulated, and have a cool little model for that. So I'm going to share this with you guys because somebody taught me this, and I thought it was really, really helpful, especially, like I said, for somebody that likes to keep it really simple when talking about the brain.
It started with a simple but effective idea, a way to visualize our rising emotions and help restore our calm, keeping our cool when flipping our lids. It's a hand model of the brain, the brainchild of Dr. Daniel Siegel, and here's how it works. Put your thumb in the middle of your palm and curl your fingers over the top. Now you have a model of the brain. Lift your fingers up and raise your thumb. That's the inner brainstem represented by your palm and wrist. The brainstem controls basic body functions like breathing, heart rate, and blood pressure. Put your thumb back down. That's the approximate location of the limbic area, most notably the amygdala, which helps to regulate emotions and our fight, flight, freeze response. Now, curl your fingers back over the top, and your prefrontal cortex, which allows us to think critically, predict consequences, control impulses, and do other executive functions, is in place. The frontmost part of the brain helps us rationally manage the amygdala and brainstem areas. But when our emotions start to rise, maybe someone's pushed your last button, or you perceive a threat or danger, our amygdala overrides the prefrontal area and we can flip our lids, losing our cool and acting in ways that can be scary to others. By visualizing our lid flipping and noticing when our emotions are rising, we can take a break or a deep breath and work to calm ourselves, giving our brainstem a chance to regulate our body and allowing us to actually change what the brain does and return to the clearer thinking of the prefrontal cortex. That's the power of using the hand model for ourselves and as a learning tool for our children.
So, like I said, just another short and sweet way to talk to our clients about this. I am just absolutely obsessed with the hand model. I think that it can be so helpful. And I know they talk about it with kids. I actually like to use, I find a lot of videos and a lot of handouts and things like that that are, appropriate for kids, but I actually use with adults. I think that sometimes I think we overcomplicate things, and it actually can be more impactful the easier we make it on ourselves. Information does not have to be hard. We do not have to use big words. We don't have to make it super heady. I mean, there's space for that. But I think when we're in therapy, I think that can be really intimidating. Therapy is already intimidating for clients. So being able to say like, hey, like this is already hard. Like I'm going to describe this in a way that feels good for all of us, that you can understand. So I just like to share that because once again, one of the things that I want everybody to walk away with today is things that you're going to be able to use in your practice with clients, wherever that looks like for you, or even just things that you can tell yourself. Because I think that that's one of my favorite things, being able to leave a training and like have something that I can actually use. So wanted to be able to give you guys a couple different things that I like for working with clients. And then now I wanted to talk a little bit, kind of same thing, talking about how we're talking about this with our clients. Wanted to, chat a little bit about complex trauma, and specifically how we have a conversation with clients that might come to us and say, I am so confused. I experienced years of childhood sexual abuse or years of physical abuse, years of neglect. And, that never really seemed like it bothered me. I kind of put it in a box and I continued about my life. And then all of a sudden I got into what seemed like, like a car accident, but it wasn't terrible. I survived. And all of a sudden now I'm living a life that feels super unmanageable. And I cannot understand why all that other stuff that feels like big T stuff is not impacting me. But then this kind of is what's leading me to not being able to get out of bed, or I've relapsed, or something's happened that they feel like their life isn't manageable anymore. So once again, I like to be able to talk to a client in using a visual. And so telling a client, okay, so if we were an egg, maybe throughout our childhood, we became fractured. But we figured out how to keep ourselves in one piece, no matter, who knows what that looks like for any of us. There's different ways that we keep ourselves together. But then this big thing happened and everything just crumbled because you were already had all these little fractures. And so talking to a client about, we don't have to necessarily look at the big thing, we can, but talking about how going back to the beginning and having a conversation around, we might need to look at these other things too. So once again, because EMDR is what I'm trained in, I kind of lean into that. And I know other modalities can talk about this in different ways too. But looking at the approach of, not necessarily talking about the biggest and baddest, but talking about the other things that have maybe led to this feeling so impactful. So it can be both. It can be that there was another big T trauma, but it can also be that there are these underlying experiences and traumas that we have to look at too. So just another way to talk to our clients about potentially complex PTSD. I also see this, and I'll have clients that have said, I experienced, my childhood wasn't great, but it wasn't awful. I didn't experience some of these big T traumas, but maybe they experienced a lot of little T traumas. And then later in life, they experience a big T trauma. And, I think they're, a lot of times, not always, but their gut reaction is, let's look at that big T trauma, and having a conversation with them around, well, we can do that. And also, in order to find healing and recovery, and from like a holistic perspective, looking at ourselves as a whole human and what other things could we need to heal from. So just being able to have a really honest conversation with clients about that. Not related to that, but another activity that I really like to use with clients is the trauma egg. This is usually when I ask people if they're familiar with this. I learned this probably about 7-8 years ago when I was a primary therapist at the ranch. And it's actually something that I used when I was in private practice with clients too. So just wanted to kind of tell you a little bit about this activity in itself, because it's just another how do we start talking about this with our clients? How do we start that conversation? How do we make it feel digestible? I think a lot of the times, a really straightforward approach is to have a client build a timeline. Well, and that can work. This is another version of that I really like, because I think it can just be really impactful in a different way. So with the trauma egg, you have your family rules, your family roles, mom, dad, or caregiver, whoever that might be. And so it outlines that you're identifying those, you're defining those. And the most interesting part is in the trauma egg, you are drawing depictions of these experiences. So you're not using any words. And when I do this with clients that have been in therapy for a really long time, they become really good at talking about what happened to them. And so having more of that narrative therapy and being able to kind of talk about it and stay really disconnected, drawing pictures really encourages us to engage another part of our brain. And it's doing that in a way that it's a kind of subtle, because you're not necessarily saying, sit in front of me and draw me a picture of how you're feeling right now. But it's giving them an activity. And I've just seen some really, really profound work be done with clients doing something like this. And I've had clients keep their trauma egg. I still have trauma egg from clients from years ago. You can Google this. There's a lot of really good information about it. There's PDF packets about it, but wanted to be able to give you all another activity that you could do with a client that can be really, really helpful for like, where do we start and what does that look like? It can also be a good way to just kind of get that conversation going with a client that might say, well, I didn't really, experience anything that bad, or I don't really even know how to describe it. This can be a good way to kind of get that conversation going. And then you can use this to inform how you use different modalities or what that might look like for you with your clients. So just another thing, like I said, love giving people things that they can walk away with. I think that can be really, really helpful. So before we take a break, wanted to go ahead and introduce us to the holistic approach and in the context of this training and what we're talking about today. So going to kind of read a definition and then talk about what it looks like for us here. And then we'll take a five-ish minute break. So according to the APA, in the prevention and treatment of disease, we should focus on the whole person. So this includes mental, physical, spiritual, social, environmental aspects, rather than on the disease symptoms alone. So you're probably noticing a theme, because I've said this before. Like I said, I'm really passionate about this. So major features of holistic health include patient education about behavioral and attitudinal changes that promote and maintain good health and well-being, and patient self-help and participation in the healing process through diet, exercise, and other measures. And so being able to help somebody heal from all aspects of their life, being able to do that in a really well-rounded way. So we take it a step further and define holistic therapy as the process of addressing all aspects of someone, and then doing that using different therapeutic interventions. So for us today, it's twofold. So a therapeutic approach and a holistic therapeutic approach being that we're using all different kinds of modalities. We're doing that as a team. So I don't have to hold space for a client in 12 different ways, but being able to help people build that support team around them and have different types of therapies that somebody's engaged in. And then if somebody doesn't have access to different types of therapies, that can look a lot of different ways too. So we'll talk about that as well. And then also being able to address somebody in all different aspects of their life. So different therapies, but then also encouraging people to find healing and overall wellness, not just, mentally, but physically, spiritually, socially, environmentally. And so being able to have conversations with our clients about, it's not going to happen overnight. It's not going to happen with just me. And it's not going to happen. It's not going to happen without being able to put in a lot of time and a lot of work with a lot of different people in your corner. So that's really wanted to say that because I think we can identify and talk about holistic. A lot of us, define that in different ways. You might, if you would like to, feel free to share with us what your definition of holistic is, because I'm always so curious to hear how other people identify that. And I think when we talk about a holistic approach and we talk about ways that we can find recovery, I have some clients, and I feel like I wouldn't be doing it justice if I didn't talk about this. I have some clients that hear holistic and they think woo woo, or, quote unquote, they think it's going to be something that, is really outside of their comfort zone, but doesn't necessarily have to be that. And so I wanted to talk about that today too, and just hold some space for the holistic approach can look a lot of different ways for a lot of different people, a lot of different clients, a lot of different clinicians. Okay, so we'll take a quick 5-minute break. So we will come back let's start back at 10:08. And we will talk about different approaches. Okay, so we're going to get started again. And so we have a couple more polls, but I'm actually going to move past those. I just want to make sure we have enough time to talk about all these different approaches. And I do have some questions, so I was going to try to answer a couple of those real quick too. Let's see. So somebody did ask about using the trauma egg in group, which I have actually done that before, and I think it can be really impactful. I've had actually clients, depending on the group and how close they are and what that looks like, what kind of group it is. I've actually had them share their trauma eggs in group and present them. It can be really impactful in a positive way for our clients that feel open to that. So I do think that it can be really powerful to do it in a group setting. Let's see. And then, yes, so one of the questions was about yoga. Yeah, so I actually do talk about a couple different types of more physical approaches. Yoga is one of them. I don't have a slide about it, but I do like to talk about yoga being a really impactful way for clients to do something that can help them find healing and isn't necessarily another therapy. So yeah, I love to encourage yoga. Yeah, somebody said something about using the word nutrition instead of diet. And yes, I completely agree. So I actually have, and we'll talk about nutrition therapy in a second. And I talk about that a little bit too, being mindful of using just with our words when it comes to nutrition and diet and things like that. Let's see. I think that was all the questions so far. And I will do some questions at the end too. But if you have any, feel free to continue giving them to Callie too in the chat, and she'll share them with me. Okay, so let's move on to different approaches. So the next 40-ish plus minutes, because I am going to try to give you time at the end. I know a lot of us work back to back. I wanted to give you some time to be able to actually go ahead and fill out some of those evaluations. As somebody that I really, love to be able to just like get things done as efficiently as possible, I want you to have time to do that today so that you can get your CEU credits. So talking about the different approaches, so we are going to talk about quite a few. Disclaimer, so I am not an expert in all of these, not even close. I appreciate and love all of these. There's some of these that I gravitate more towards because that's just what I enjoy with clients, and that's what I feel like my scope is in. Different people utilize different approaches. When I've done this training before, I've actually learned from other people about different approaches that I don't have in here. So just wanted to say that I recognize there are so many more approaches than this. So we're just going to explore some of them today. And as I hear from people, I do plan on expanding this and adding some. I think I've learned a lot from different people of just like things that they use, which is one of the reasons why I love doing this in person too, and being able to have a little bit of a discussion around that. Because I think we can learn so much from our fellow practitioners of what they do and what works for us and our clients. So I just wanted to put that disclaimer out there. Like if you have a type of therapy that you like to use with your clients and it's not here, like probably isn't. And that's totally okay. I just wanted to let you know that it's not because like I'm not hating on it. I don't think that it's not helpful. I just didn't include it today. But I would love to hear about it too. So without further ado, so some of our different approaches. So we are going to talk about EMDR. Like I said, this is the type of modality that I really lean towards. It's where I'm trained, it's what I'm trained in. And I really like to use it with some of my clients. And then we're gonna talk about brain spotting, acupuncture, massage therapy, experiential therapy, somatic therapy, equine therapy. So we're gonna talk about that from a couple of different angles, about horseback riding, but then also about different kinds of equine psychotherapy. Nutrition therapy. So like I said, we are going to talk about a nutrition approach. And I'm going to talk about how to be mindful about that, especially for those of us that work with eating disorders and are very aware of needing to use some sensitive language around that. We're also going to talk about medication management. So we'll just spend a little bit of time chatting about that from a team approach. And then we actually close with spirituality. And we'll talk about that a little bit more and how to utilize that with our clients. So like I said, many, many, many more. I do want to encourage you to think to yourself about what are modalities that you maybe lean towards. What do you maybe refer out for a lot? What are maybe some that you are really interested in? I think that for me, I know that one of the things that I really want to push myself on is, learning more about others and not necessarily getting trained in them. I mean, that's cool too, but just knowing more, because I think the more that we know, the easier it is to be able to tell a client like, hey, I think this could be really helpful for you. You don't have to do it with me, but this is maybe something else that could really help you find some healing. And being able to refer out. I think a big part of what we need to do as clinicians is know whenever it's something that we can't help a client with, and that's totally okay. There's nothing wrong with us when we can't treat what a client has going on, or we've done what we can for a client and we need to say, hey, somebody else needs to start working with you. So yeah, I think it's really helpful to learn about many new, and I'm always trying to make sure that I am, and I'm talking to different people that do different things than me. So starting out, talking about EMDR. So EMDR was developed by Dr. Francine Shapiro in 1987. So the story that I was told when I did my EMDR training, and I say that apprehensively because I'm always like, I don't know if that's true or not, but I was told it during my training that Dr. Shapiro initially discovered this because she was walking and her eyesight was actually following something. In my training, they said that she was following a butterfly. And as she was walking and thinking about something and her eyesight was following this butterfly, she actually noticed herself feeling and processing something in a different way than she had before. So EMDR is a really structured therapy that encourages the patient to focus briefly on the trauma memory while simultaneously experiencing bilateral stimulation. And so that's the eye movement. And so thinking about, the example that I gave that she said she experienced, which was following something with her eyes. So your eyes are going back and forth. So the eye movement actually reduces the vividness and the emotion associated with the trauma memory. It is extensively researched, known to be a really effective form of therapy, and can be really impactful for people with trauma or PTSD. And I obviously, of course, today we're talking about trauma therapies, but also wanted to say that EMDR has been found to be really effective for all kinds of different disorders. Here we're listing anxiety, depression, OCD, chronic pain, other addictions, other distressing life experiences. So it can be really helpful for people that have a lot of different disorders or diseases and have a lot of different things going on. Also wanted to throw in another statistic and talk a little bit about some numbers that they've shared before from 2016. So 7 million people were treated successfully, which means there was a reduction in vividness and disturbance by 110,000 therapists in 130 countries since 2016. So just thought that that was really powerful. EMDR is definitely a really popular therapy right now. So once again, not the only, not the best necessarily, just happens to be a really popular one. EMDR is actually something that we do offer at the ranch, depending on if a client's appropriate for that or not, which could mean that somebody is, regulated enough and is able to identify different memories that they are going to be able to work on. But we do offer EMDR and brain spotting as well, but offer EMDR at the ranch. And like I said, this is one that I really utilize with my clients when appropriate. A lot of different examples of, times when I've found this to be really impactful is people that like really structured therapy. And so when you learn EMDR, they teach you that you need to do it by the book. You have to stay really structured in it. And some of our clients can really gravitate towards that. So I have some clients that really, really love this. So it's not a type of therapy where you're talking about what happened. So there's not a lot of narrative talk therapy when we're doing EMDR. So there's some clients that really don't like that. Some clients might not like it, but might need it, and that's okay too. But this is just wanted to kind of talk about how this is not a therapy where somebody is, using a lot of words to describe what's happening for them. So they are, processing that a lot internally. And you're really working through that with a client by saying, what are you noticing now? How distressing is the experience still, and how vivid is it? And you kind of ask those questions over and over again as you're helping them reprocess. And then next is brain spotting. So brain spotting was developed by Dr. David Grand in 2003. So it has roots in EMDR, somatic experiencing, relational and insight-oriented therapy. I used to kind of refer to this, especially when clients would be like, I don't understand, like, what's the difference? What's brain spotting versus EMDR? Or I've done some other kind of therapy. Like, what is brain spotting? I know about EMDR. I talk about it. It's kind of the cousin of EMDR is how I like to describe it to clients. And being able to kind of help them sort it out that way. Because once again, as we're talking about all these different modalities, if you think about how us as clinicians or as people that are exposed to, the treatment world, it can be a lot for us. It can be overwhelming for us to go, oh my gosh, there's so many different things. There's so many different types of therapies. And so sometimes I kind of take a step back and think of like, oh, wow, like how overwhelming is that for a client? You think about a client that goes, trying to find a therapist, trying to figure out like how am I going to find recovery, how many different modalities there are. So trying to, once again, we can be well-versed in all these things, but then also keep it simple for our clients and be able to say, this is how I describe it. And I always say, like, this is not the therapy that I know how to do. And so you're going to have to talk to a therapist that is trained in this, and they're going to describe that to you too. Here's kind of like the nuts and bolts of it. And so also when I do this training in person, I like to ask, and it's really interesting because there's usually somebody that is in front of me in the training that actually does one of these therapies. And so I usually like to give them the opportunity to describe it to us, which can be really fun. Dr. Grant, so he discovered brain spotting while he was working with a 16-year-old figure skater who could not master a triple loop. So once again, learned about this story, kind of like my butterfly story with Shapiro. And I just like it because it helps me remember the different therapy. So once again, this is in the research that I found. So wanted to be able to share with you all too, because I think it's a cool way to remember it. So during a therapy session, he prompted the skater that he was working with to visualize a really challenging maneuver, pinpointing the critical moment where she believed failure was imminent. And then at that point, he instructed her to track his finger movements with her eyes. And so for brain spotting, they use a wand. And then suddenly when he was doing that, the skater's eyes began to flicker intensely. And then 10 minutes later, process stopped and the ocular blockage stopped. And then, subsequently following this, she was able to successfully complete and do a triple loop, which I thought was really cool. So once again, I think sometimes these stories that we have for how they were developed can be really helpful to share with clients too, and just say, like, this is how that worked. For me, with going back to EMDR, like I would share, because when you learn how to do EMDR, you actually have to practice with each other. So sometimes, if appropriate, I'll share what that looked like for me or other practitioners when we actually had to, pick a small memory and process it with each other. And that can be really helpful for clients. Of course, always doing that when appropriate. And, I'm not self-disclosing anything, but being able to give them the kind of insight of like, what does that really look like, can be really soothing for a client. So brain spotting is a powerful focused treatment method that works by identifying, processing, and releasing core neurophysiological sources of emotional body pain, trauma, dissociation, and a variety of other challenging symptoms. So it's, both treatment and a diagnosis, because you're saying, okay, that something's blocking. And it's also it can be enhanced with bilateral sound as well. So once again, like, you'll probably notice that there are things that feel and sound similar to EMDR. So it works within the deep brain and the body through its direct access to the body's central nervous system, and can have a lot of really profound psychological, emotional, and physical consequences. So in a nutshell, brain spotting therapy is a type of alternative therapy that uses spots in a person's visual field to help them process trauma. So if I have a client and I'm like, okay, so they're not responding well to EMDR, or they're not open to it, or I know that it might not be a good fit for them because they like to talk or they don't want something quite as structured, brain spotting might be a good therapy to offer them or, refer them for. And then next, we're going to talk a little bit about acupuncture and massage therapy. So the ancient practice of acupuncture started in China approximately, a really close 3,000 years ago. The first documentation of acupuncture that described it as an organized system of diagnosis and treatment was in the Yellow Emperor's classic of internal medicine. And that's actually also where massage therapy was first noted too, and that's dating back to 2700 BC, first appearing in China, India, and Egypt. So by treating areas of the body, acupuncture can actually help release emotional pain that is being held in the body's tissue. So helping you to process the feelings and memories, let them go and move on. And then I say all this saying that, of course, a type of modality like this, a therapy like this, isn't for everybody. Of course, we're going to have some clients that anything hands-on is not going to be something that they are going to be open to or is going to be helpful for them, which is totally okay. We're going to have some clients that this could be really, really helpful. And then talking about kind of even yoga therapy too, which I know I said that I don't have it listed here, but it's another way that we can be in our bodies, or we can be doing something physical that isn't actually therapy. So I'm not necessarily going to a massage and thinking about, I'm processing my trauma, and I'm not talking to the massage therapist about that necessarily. There are different types of therapies that might be integrating that, but in what we're talking about today is more, this is a separate type of experience that a client could have. And then yoga is the same way. And I tell people all the time that for me, whenever I go to yoga, because I practice yoga, is that it's something that I do for my mental wellness. And it's not necessarily something that I'm doing for, a physical like exercise, quote unquote. So I talk to my eating disorder clients about that a lot too, of like, how can we start to recognize when we're doing something that's disordered, and then when we're doing something that's for our wellness, and having to have conversations about that. So I wanted to kind of put a little piece about yoga in there, specifically around working with eating disorders as well, because I do think that yoga can be really helpful for our clients. And we actually integrate that at the ranch as well, because I really believe in the impact of like learning how to get in our bodies. We're about to talk about experiential therapy, and so it can feel similar to that as well. So experiential and somatic and equine therapy. And so yoga could be identified as a somatic therapy. And so talking about these three too, so I've listed them together, but then I'll talk about them separately as well. So experiential therapy encompasses lots of different types of modalities and types of things that you can do, types of activities that lead us to connecting with our body. A somatic approach is specifically focusing on the body and how emotions appear within the body, or where somebody's feeling that, having a client connect with that. And then equine therapy, allowing us to build connection and relationship. And so at the ranch, we also, we have an equine program that I'm really proud of. And they do a great job over there. And I think being able to help people connect with horses and learn how they can also then understand how better to connect with themselves and other people can be really, really profound. So all these approaches, among some others that aren't listed, once again, disclaimer, I'm not listing everything, can really help people move away from intellectualizing and ruminating. So it's a different type of therapy. I think a lot of our clients will maybe come to us if they haven't been in therapy a long time, or maybe have and just have only been exposed to some, and they'll think that therapy has to be, sitting in a seat talking about my feelings. And so being able to open up the door to therapy can be so many different things. And we can do that in so many different ways, and how impactful that can be for some of our clients. especially some of our clients that might have been in therapy for a really long time, and they've, like I said previously, gotten really good about talking about what happened to them, but they're not necessarily feeling anything about that. So they're a little bit more disconnected, or they're talking in circles, and don't necessarily recognize that. And that's, they've just created some other coping mechanism where they don't have to feel it. And so being able to say for a client, like, these are things that could work really well for them. So, and I say all that to recognize that not all of our clients can access different types of therapies. So I am going to talk about things that we can do in our individual therapy. If we have a client that we're like, okay, yes, this would be really helpful, but like, my client doesn't have access to this. And how could I do that actually with my client if I want to try something that feels a little bit different than, you know, your typical talk therapy? So we will talk about that. So for, like I was saying, so for a lot of people, the idea of therapy is sitting face to face, talking to a professional, addressing how we're feeling, you know, reprocessing something, thought reframing, things like that. Experiential therapy doesn't have to be quite as rigid. And it doesn't have to be quite as structured necessarily. I don't think all talk therapy is rigid, but it doesn't have to be necessarily maybe quite as structured. And that's how I describe it to some of my clients that might feel open to it. Also, of course, a lot of us don't have access to, like at the ranch, we have a zip line. You know, we don't have a zip line. Like when I was in private practice, I didn't have a zip line. I didn't have, you know, high ropes courses that I could use with clients, but there are different things that we can do with our clients that can feel experiential in nature and we can do in our office. So by definition, experiential therapy requires clients to immerse themselves in a variety of experiences. So experiential therapists believe that for clients to get better, they must come to terms with their experiences by getting a sense of what is happening subconsciously. And so being able to move through that. So the roots of experiential therapy are in client-centered and Gestalt therapy. And it also is an activity-based therapy. And so it can look a lot different. And it can look a little bit more like a doing than a sitting and a talking. So one of the activities that I like to do with clients in my office is to actually set up 3 different chairs. And so if I have somebody that has experienced trauma and, you know, we've been talking about it for a while, and, you know, maybe they're feeling a little stuck. And so what I will have them do is there will be a chair for past, a chair for present, and a chair for future. And I'll actually have the client physically sit in each chair and describe what it feels like to be in their past, their present, and their future. And so for their future, you know, I prompt them to look at that, like, what does recovery, what is healing, what does that feel like for you? And then being able to go into their past and what does that feel like for you? And then being able to sit in their present, which is a lot of times I'm like, that's you and me right here. Like, how heavy, how hard is this right now? But then to be able to shift out of that seat into the future seat, oh my gosh, like, it gives me chills just thinking about it. Because I just watch clients be able to have that experience. And it's not, I mean, I'm not doing anything earth shattering. I'm really not doing, I'm not teaching them anything, but them to be able to physically move from one space to another gives them that opportunity to kind of see what it feels like to shift. And so being able to take that subconscious experience, that subconscious feeling, that thing that's really deep rooted, and be able to actually do something with it can be really, really impactful. I also have used scarves in the past. So you can get scarves off of like Amazon or something, but we'll have clients, you know, pick scarves and of different colors that represent different things, different feelings for them. I'll have them either, you know, put them on themselves or put them around the room, and then have them describe what it feels like to do something like that. What does it feel like? I had a client once and she took the black scarf that represented a lot of pain for her and she actually put it over herself. And then she wrapped all these other scarves that represented all these different feelings around herself. And then she made herself really small on the floor. And I was like, what does this feel like for you? And she put her, you know, she's putting herself and she's describing this to me. And, this is somebody that's maybe talked to me for a really long time. This is somebody that's, had a lot of conversations with me about how she feels, and what her past was like for her. And as we're, processing some of her trauma, but being able to kind of take those emotions outside of herself, put a color to it, put an object to it, how impactful I watch that be for somebody too. So that's another example. I've also had clients pick an object in the room and that they feel like that they gravitate towards, and then tell me why. So people that have experienced childhood trauma, they will actually, maybe gravitate towards something that is broken or something that, feels small and fragile, and then having them describe that to me and then relate that back to themselves. And so once again, it's a small doing. It's a thing that they are engaging in physically and then are talking about with me. So you're kind of doing both, where you're having the more experiential exercise and then they're talking about it. And then last example that I'll give, because I've used this in residential therapy before. So I haven't used this outpatient. I don't think it would be appropriate outpatient because they're not in a structured setting. But I've actually had people that have really struggled with chronic suicidal ideation actually carry around a really heavy rock with them that represents their suicidal ideation. It represents what that's like for them. And as they're carrying that around and they're bringing it places with them, and then they're noticing how heavy it is and what that's like for them. I had a client once that decorated the rock and made it really pretty. And when we sat down together and she talked to me about why she made that rock really pretty, I'm like, why did you make your suicidal ideation really pretty? What is that for you? Where is that coming from? And helping somebody make those connections in a different way. Similar, kind of going back to the trauma egg, getting people to access a different part of their brain, which is why I, once again, you can probably tell, really passionate about types of therapies like this too, and leaning into that. Feel similarly to somatic therapy. So it's, once again, a different type of therapy that's been used for centuries. And this is going to be more about, how are you feeling physically? Like, what's going on in your body? How do we connect with ourselves? A lot of our clients, especially when I worked with eating disorders, worked with people with dissociation, I used to draw a stick figure for them. And so your body's here and your head's over here. And so as we're doing therapies like this, I'm like, we are realigning, because we're really like forcing ourselves to be connected because we're moving through things, or we're, identifying how we're feeling and where we're feeling things in our body. So different types of somatic therapies. So describes it as 4 different types. So there's somatics, somatic experiencing, Hakomi method, and sensory motor therapy. So many different types. What underlies a lot of somatic therapies is the belief that the body can manifest mental unease. And then we can also heal it that way. So being able to have a client say, I feel my anger right here in my chest. And then I say to them, like, what color is that? Can you describe that for me? What shape is that? So once again, being able to identify the feeling in a different way and then be able to move through that. I've also had other clinicians talk about a more somatic approach being like, if somebody's feeling something in, quote unquote, really big, being able to walk them through more of like a guided mindfulness exercise of seeing that feeling. So once they've described the color, the shape, I've even had them describe the consistency, and then describing and talking about it getting really, really tiny and putting in a box. And so can be used as a grounding technique as well. So just another way that I think somatic, and then kind of obviously in an experiential, can be similar in nature. And I use them really closely with each other. In EMDR therapy too, being able to connect with the body and say, what are you feeling physically right now? And so the type of EMDR that I was trained in is a safe approach. And so I connect a lot with somatic of, where are you feeling that? And like noticing how that might move or shift can be really helpful. So our clients that are really disconnected from their bodies, they are going to hate this. They don't want to do this. They don't want to connect with their body. They want to stay disconnected. And so recognizing when and how we can work towards this in a way that feels safe for somebody. And then talking to our clients about how do we reconnect with ourselves? What does that look like? And so a gentle approach could be yoga. That could be going on a walk or things like that. So being able to, there's different degrees of this, and being able to introduce it in ways that feel good for our clients. And then talking about equine therapy too. So equine therapy has so many benefits. So initially, those benefits dating back to 460 BC was around horseback riding. And so noticing like that just the feeling of riding, that rhythmic beat, was really impactful for people physically. And so on one hand, it can build a lot of physical strength, and it can be really good for people with disabilities. It can be really impactful in both regards though. And so what they slowly started to find is that, okay, so this is not just a physical outlet, it's not just a physical means of recovery, but it's also an emotional, mental outlet. So the 4 different types of equine therapy that I have listed here, and there's so many more too, is therapeutic horseback riding, hippotherapy, equine assisted learning, and equine assisted psychotherapy. So for the purposes of today, we're talking a little bit more about the equine assisted psychotherapy. So this includes a therapeutic aspect. So the individual's reflecting upon their feelings and their process with the horse. So what did it feel like when I was interacting with this horse? So you're moving them through different exercises. So, there's some equine therapies that are on the horse, and there's some equine therapies that it's only groundwork, which is what we call it. So you might be grooming, feeding, you're doing those ground exercises, or you're doing the riding, depending on what it is. And so you're working with the therapist to describe your feelings around that. And so how am I connecting with this horse or not? And how does that reflect my relationship with people and those around me? And being able to help clients make those connections. I have seen people and have gotten feedback from clinicians and equine assistants and my barn manager about clients that come to the barn and are not open to equine therapy at all. They're like, I don't want to be around the horses. This is not for me. Once again, so it can kind of feel like that, what we were talking about, the holistic approach, people being really, afraid of it because they think that it is more woo-woo, quote unquote, whatever that looks like for them. Or like this, this isn't for me. Like, I don't want to play with the horses. But then some of those clients can have the most profound experiences, because what they're doing with those horses is recognizing, that they are reflecting back the connections that they are or are not able to make with each other. This can actually be really impactful too for couples. So if you're dealing with couples that have experienced maybe a shared trauma, or trauma within their marriage or something like that, working with the horses can be a really profound way for them to see how they are or not connecting by integrating equine therapy. And so now we're talking a little bit about nutrition therapy. So this was first recognized, Hippocrates first recognized this, the science and philosophy of clinical nutrition in 4th century BC. So determined that health could be measured by proper, he used the word diet and hygiene. So once again, being careful about how we use that word. I'm glad somebody said that, because I think that there's a lot of misconceptions about nutrition therapy. There's a lot of clients struggling with eating disorders or disordered eating, and they have no idea. They're not aware that that's what's going on for them. So nutrition therapy isn't about weight loss. It's not necessarily about being on the proper quote unquote diet. It's learning, how am I taking care of myself? I'll see a lot of clients that have had extensive childhood trauma that are not feeding themselves, not giving themselves water. They're doing a lot of these things because they don't know how to take care of themselves, because that's what they experienced when they were growing up. And so aren't even consciously aware of how this eating disorder or disordered eating is really at, at the root of a lot of their symptoms, and that it's a part of their self-harm. It's a part of how they don't know how to take care of themselves because nobody took care of them and nobody showed them how, or they don't feel like they deserve to be taken care of. So it's something that they're not even aware of. So being able to help clients recognize when that's happening, and then getting them connected to somebody that's going to do that in an appropriate way. So being really also mindful of, we're not sending them to somebody that is going to encourage, once again, a quote unquote diet. We're not going to encourage them to eat a certain type of way. Like, that is not what we're recommending. We're recommending for them to talk with somebody like, how do I start taking care of myself? How do I meet this need that nobody ever met for me, that I'm now recreating as an adult? And a lot of times this can look like one-on-one therapy. There's also some really powerful group therapy around nutrition, talking about body image as well. Once again, I used to work with eating disorders, so I could talk about eating disorders all day long. And I think that there's a lot of, especially when we talk about treating trauma, there's a lot of eating disorders that clients are keeping really close to the vest. I've had clients tell me, I'm not giving this thing up. I wasn't planning on giving this thing up. I didn't want you to see it. I didn't want you to notice it. So I think I always also like to encourage people to explore what is an eating disorder. If you work with trauma, you are going to work with people that have active eating disorders. And so being able to say, you don't necessarily have to know how to treat that, but being able to say, how do I refer for that? How do I notice the signs and symptoms and be able to make sure somebody's getting what they need? Because I see a lot of clients that will come to me and say, I plan on keeping this forever. And that, as a clinician, as somebody that's holding space for them, is so sad, because I recognize, the inability to find that healing for them holistically because of that. And then, a lot of that's coming from some deep wounding. And so talking about it in the context of that too, and how powerful that can be. So my belief is that a holistic approach always, always, always has to include this to some degree. Once again, we don't have to know how to do that. Like, this does not have to be your area of expertise, because I think for us as clinicians and providers, being able to know when to refer out, or when to say like, hey, I need to connect you with another professional that knows how to do this, can be so helpful, because then also they have another person that is supporting them or is in their corner. And then if we work with people, we know this is happening, like being able to educate ourselves about it too. Because then also, recognizing like when we use those sensitive words, we don't even realize it. It is pretty ingrained in our society. And so learning, how can I be mindful of how I'm talking about food, how I'm talking about diet, how I'm talking about these different things, because you never know when somebody that is potentially active in their eating disorder is sitting in front of you. And then another piece I wanted to talk about is medication management. So, this is obviously a really traditional approach to treatment here, specifically in the States. I like to talk about that just a little bit, but recognizing that medication management coupled with therapy is always going to be what is going to be appropriate. And I think a lot of our clients want to do one or the other, or neither, depending on where they're at. But being able to connect with our providers and connect with the people that are treating our clients, how helpful that can be. And so not only knowing that somebody is having those needs met, but also coming at this, I want to talk about this as a team approach. So being able to connect with those providers and have conversations with each other, so that once again, we're not doing this alone, which I think can be so impactful for our clients too. A lot of, whenever we've experienced trauma, we don't know what it looks like to have appropriate support and community. And so being able to do that by saying like, yeah, I can have a conversation with your med provider, if that's appropriate. And yeah, and I can really connect you with somebody that I really trust. And I know that I've always loved, especially in private practice, loved referring to people that I knew and trusted and had a relationship with if my clients could access them. Because I do think it's really impactful if somebody is taking medications to also be in therapy and to be doing some other things too. And then last but not least, talking about spirituality. So spirituality is something that we all define in a lot of different ways. For the purposes of here, I wanted to share this definition that the British Association for Counseling and Psychotherapy had. And then did want to invite some of you to take a moment just to reflect on this for yourself as well. So this defines it as it deals with the meaning that people make of their lives. It faces suffering and its causes. It relates to God. God is his ultimate reality. It often uses the word soul or higher self. Techniques such as prayer, meditation, contemplation, mindfulness, yoga, tai chi are often used as spiritual practices. So there's different ways we can look at this with our clients. I frequently talk to our clients about, what is your purpose and what are we doing here? Here talking about this world, earth, like what are you doing here? And how do we connect with there being more? And so being able to connect with that why, being able to help our clients connect with what is your purpose. Of course, we once again have to be really mindful that people have experienced all kinds of different traumas. So I always, talk to clients about this, opening the door for them and saying, what does this look like to you? And then helping a client navigate that if they get really stuck in that. But there's a lot of different ways that we can talk to clients about connecting with their higher power and then ultimately connecting with themselves. The conversation I have is that if we can't find our why, we can't find our purpose, and we don't know what we're doing it for, then how are we connecting with ourselves? So giving people the space to navigate that and talk about that. This can also be an opportunity to learn more about different ways that our clients have been hurt, different traumas that they might not have realized because of the way that they show up when we ask them these questions. So just wanted to give you guys some space to just think about that too. That's the reason that I really wanted to leave this as the last modality that we talked about, because I do think it is so personal, how we connect with our higher power, how we feel, what spirituality means to us. And so wanted to kind of give you some time to think on that for yourselves as well, maybe just throughout the rest of the day. So in summary, a holistic approach for trauma treatment ensures that a client's healing is all encompassing. The best thing to remember is that this approach typically takes a team. So the healing process never occurs overnight and it rarely happens easily. So why should we do it alone? So you cannot heal a lifetime of pain overnight. Be patient with yourself. It takes as long as it takes to rebuild yourself. So if we've experienced this for years and years and years, and we have a string and we've unwrapped that string for decades and decades and decades, and all of the trauma and all the hurt that we've experienced, we can't wrap that up and pull that back in and process that overnight. And we certainly can't do that alone. I know we can't do that alone, and our clients can't do that alone. So as professionals, we are also allowed to take space with other professionals and talk about, how we're feeling and what's going on for us as well. And being able to do that as a team. A lot of what we're doing with our clients is really heavy, and being able to share that space. If we ever find ourselves working with the clients and feeling like it's all on us and we're alone, I really encourage you to think about this approach and how can I help build a team around this client? What does that look like for them? And being able to give them some space and give yourself some space to not have to do that alone, because our clients don't have to do that alone. So we shouldn't have to either. And that's all I have for us. I'm going to take some time just to read some questions and see what some of you may have asked throughout that. Okay, so one of the questions was about how do you know the EMDR is appropriate? So a lot of times when I'm working with a client, if they are dissociating, dysregulated, constantly, they're not able to ground themselves, I would maybe say, hey, we probably shouldn't go into reprocessing yet. So the initial phase of EMDR is grounding and learning how to stay connected. So sometimes I'll introduce it to a client already, but not always, because I sometimes I think once you start that process, they hear and know what's coming next, and that can be a little jarring for somebody that might already be dysregulated. So if somebody can't ground, I usually don't introduce a new modality like that quite yet. And then somebody else said, how does EMDR do with complex trauma? Is it better if there's a specific big T trauma? So this is actually when EMDR was created, people initially used it with one big T trauma event. So when you have somebody with complex trauma with EMDR, you're usually going to have to do a couple different structured EMDR rounds. And so that it can be really, really impactful for a client. But EMDR uses a core negative belief. And so if a client identifies a core negative belief, then they find different memories that connect with that core negative belief. So somebody that has complex trauma, they might have a handful of really, big core negative beliefs. And so the goal is that you work through those negative beliefs. So if their negative belief is I'm not good enough, then you identify the different experiences that feel connected to that. What I always tell clients when we're doing that, especially clients with complex PTSD, complex trauma, is that the trauma that you came into my office to work on may not connect with that core negative belief, and that's okay. That doesn't mean we're never going to work on it, but we're not going to work on it right now, which can be really interesting for clients. And I think sometimes it can take some of that pressure off of clients to say, like, we're not going to work on that one right now. Actually, like, we don't have to. We can find a lot of healing working on some different things first. And so the structure of EMDR is not necessarily to go to the big and the baddest first, which I always tell clients, because I think that can be really helpful for them, because sometimes they're like, I don't want to do that kind of therapy because I don't want to talk about that yet. To be able to let clients know that there's different ways that we go about doing EMDR, and it does not necessarily mean that you have to focus on the big T trauma. And then, so somebody said, what is the giant leap? So yeah, I did kind of brush over that example. So the giant leap is an experiential activity. So it's a high rope activity that we have at the ranch. And so what somebody does is so they're strapped in and they climb up a telephone pole, and there is a place for them to stand on the top of the telephone pole. And so the different clients are around them. And what they do is it's the process of surrendering. So surrendering to your higher power, surrendering to God, and letting go. And you're doing that with different people around you. And then you actually step off of the pole, and being able to see what it feels like to surrender. And so it's part of some step work that you can do. You don't have to do step work if somebody's not working through that, but that's the process of the giant leap. So it's an experiential exercise. So some different training and certifications recommended for these. So for EMDR, so EMDRIA is a organization that does, that's where I got my EMDR certification from, or not my EMDR training, but they do have a certification process. And I'm biased, of course, but that's the one that I utilized, and really, really had a really great experience. And there's a couple different that offer brain spotting, so you can Google that as well. Same goes for equine therapy. So there's a couple different kinds, but there is a groundwork equine therapy that you can get trained in. And EGALA is the one that's most frequently talked about, but there's a couple different ones that you can get certifications from, or you can expand on. And then there's so for yoga and things like that, certifications in yoga therapy, there are some certifications for therapists specifically that are interested in how do I integrate yoga into treatment, which can be really, really cool. For me, I've never done that because yoga is something that I like to practice personally. So I don't bring that into my therapeutic space with clients. But some people, that's what they want to do, and they want to utilize that with their clients, which could be really, really impactful. And I know we're running out of time, so I'll probably have to stop there. And I will let Callie take over with any other housekeeping things that we have. And I appreciate you guys and all your time today. Thank you so much for letting me talk to you.
Lauren, that was great. A lot of really sweet and wonderful feedback. So yeah, just really quick. If you have any extra questions for Lauren, I have made a note of them. And I'll make sure that we kind of just cover anything we didn't hit now in that recap email for next week. Again, we hope to see you all in July. I already sent the registration link in the chat earlier, but I'll send that out again next week. Look out for the eval if you are looking for CE credits later today. And I think that's it. Have a great weekend, everybody. Thank you, Lauren. Thank you so much.